Hi, today we're going to talk about the function of the pulmonary surfactant in the lungs. So let's cover some definitions before we begin. We're looking at a diagram of the small air sacs in the lungs, and this is where the oxygen exchange takes place. Each is called an alveoli, and alveolus is plural. These are the terminal air sacs where the gas exchange takes place. So carbon dioxide is breathed out while oxygen is breathed in. The hyaline membrane is a thin layer of cells that line the lung. The light pink bubbles in the diagram are your air sacs. So the bronchial in the lung, as it descends, you will see the terminal bronchial and then the respiratory bronchial. Then the cross section of the alveolar sacs shows you the individual alveoli in the upper right. So the pulmonary artery is in blue, descending down the capillary network, as the pulmonary venule in red is leaving the capillary network around the alveolus. So we'll also be discussing a lot surface tension in this presentation, because surface tension is the attraction of molecules in a fluid. Surface tension is the attraction of molecules in a fluid for each other. And the surfactant in the lungs is what controls the surface tension. So the surfactant is a mixture of phospholipids secreted by the type 2 cells in the air sacs into the alveoli and the air passages. So they contribute to the elasticity and they reduce surface tension. So what is pulmonary surfactant? Surfactant is a substance that's produced in the lungs. It's made of 6 lipids and 4 proteins. It also is synthetically manufactured, and we will talk about that and where that's used in just a few. Okay, so I want to look at some things in the slides of the lungs before we go any further, because I love slides and these are really cool. The one in the pink, you can see the air sacs and the arteriole, and alveolus means little cavity. So they are the tiny air sacs that allow for gas exchange to happen in the lungs. The arteriole is just what it sounds like. It's a very small branch of the artery leading into the capillaries. So the purple slide, this shows the respiratory bronchiole, the alveolar duct, the alveolar, and the alveolar sac. Okay, the purpose of surfactant: to reduce surface tension and keep the air sacs from collapsing. So the surfactant is in the alveolar surface in the lungs, and the surfactant prevents the collapse at low lung volume. It preserves the lungs during normal inhalation and expiration. So that's the breathing in and the breathing out. And this is referred to as a biophysical function that helps protect the lungs from injuries and infections. So some of these infections are caused by inhaling particles and microorganisms. So the surfactant is illustrated in light blue in both of the pictures that are on the slide to the left. And you can see how the surfactant covers the area adjacent to the airspace in both. In addition to the thin wall-forming type 1 cells, 5% of the alveolar surface epithelium is covered by type 2 alveolar cells, and these cells secrete pulmonary surfactant, a phospholipoprotein complex that facilitates lung expansion. So furthermore, defensive alveolar macrophages stand guard within the lumen of the air sacs. And when is the natural surfactant produced? Well, it's produced by the alveolar cells in the lungs. They also line the small bronchioles and prevent the alveolar from collapsing. The natural surfactant is produced by the fetus prior to birth. This is in preparation to breathe once they are born. So the fetal lungs are properly suited to breathe at about 37 weeks. So if labor should start prior, a preterm emergency like a cesarean is performed, and a lung surfactant is given to prevent respiratory distress syndrome. So what does it do when they give this emergency treatment of surfactant? It allows the oxygen to penetrate the lining and move into the blood. When your body cannot get enough oxygen, it's hard to breathe. So babies are labeled premature if they are born before 37 weeks of gestation. So between week 24 and 28, a fetus can start to produce a surfactant. By about 35 weeks, most babies have enough naturally produced surfactant to keep the alveoli from collapsing. But premature babies are likely to need surfactant replacement therapy. Over half the babies born between the 28-week gestation needed this treatment, while about 1/3 born between 32 and 36 weeks needed supplemental surfactant. So some very premature infants may also need to be placed on a mechanical ventilator. When you look at the slides, you're going to see the preterm lungs on the left at 24 to 35 weeks, and then the lungs on the right illustrate a 36-week gestational age up to 3 years. So the baby's lungs born early just have not developed, as well as the full-term babies on the right. It's easy to see why they would struggle so much to breathe when you look at these two slides here. So the alveola, which we call the air sacs, that are made of a spongy tissue. So oxygen is taken up by the blood and carbon dioxide is released and exhaled. For this exchange to occur, the surface area in the alveoli must be as big as possible. So under normal conditions, when a person exhales, the alveoli would collapse into each other and form larger air sacs with less surface area. We already learned that surfactant prevents this collapse by reducing the surface tension. So this helps to equalize the pressure between the large and the small air sacs. And you can look in the diagram that shows the lung complications for the respiratory distress syndrome of a baby, and you can see the normal on the left and then the collapsed on the right. So surface tension is the attraction of the molecules to each other. So the attraction will pull the fluids into the smaller surface area. And when the surface tension is lowered, it will cause the attraction among the molecules to decrease. This causes the surface area of the fluid to increase, allowing more area for the gas to exchange. So surface area available for gas exchange. Without this, you would be exhausted and you just wouldn't be able to get any oxygen. Babies without enough surfactant have infant respiratory distress syndrome or hyaline membrane disease. So the synthetic surfactant needs to be administered quickly after birth, and they usually say within about 6 hours. The artificial surfactant is a white powder that's mixed with sterile water, and it's given through a breathing tube inserted into the baby's lungs. Several doses are usually administered. So the replacement therapy will continue until the surfactant can be made naturally in the baby's own lungs. And this has reduced deaths by about 50% since the treatment began back in the 1990s. Some very premature babies are also put on mechanical respirators to assist with breathing. And really the only way to prevent the neonatal emergency is to prevent the need for additional surfactant. So to do this, we need to be able to prevent premature births. High-risk mothers are given corticosteroids towards the end of their pregnancy. What the corticosteroids do is they will stimulate the baby's lungs to mature, making the surfactant sooner than normal in the babies. The doctor will look at the degree of respiratory distress as well as oxygen levels when the babies are born to determine whether they will need the artificial surfactant. So neonatal doctors are usually the physicians that care for babies receiving the surfactant therapy. And premature newborns often have other health problems also that play into the treatment. So they have to look at everything all together and decide on their timing. So to administer the surfactant, a breathing tube is inserted down into the lungs. There can be complications where the air leaks to the sac around the heart, and some of these babies will develop a chronic lung disease. So replacement therapy keeps the babies alive until they can produce their own surfactant in their lungs. And surfactant replacement therapy is very effective if it's began within those first 6 hours after birth, but when it fails, it may result in death of the infant. So let's look at the alveolus without surfactant on the left and compare it to the one on the right with the surfactant. The one without the surfactant on the left has an attractive force that pulls inward and it can collapse the lung. The example on the right with the surfactant, it has the repulsion due to the lipids in the middle and the polar heads and the lipid tails. We've talked about this in prior chapters. This is what keeps the air sacs open. So when we look at the law of Laplace, if you have two alveoli of unequal size, but the same surface tension is connected by the same terminal airway, the smaller alveolus, because it generates a larger inward directional collapsing pressure, has a tendency without pulmonary surfactant to collapse and empty its air into the larger one. The pulmonary surfactant reduces the surface tension of a smaller alveolus more than that of the larger alveolus. This reduction in surface tension offsets the effects of the smaller radius in determining the inward directed pressure. So consequently, the collapsing pressure of the small and the large alveolar are comparable. So in the presence of pulmonary surfactant, a small alveolus does not collapse and empty into the larger alveolus. So if you want to look with me in example A, at the top, it shows without surfactant, and you can see the attractive forces create a high surface tension, pulling molecules together, leading to a collapse. With surfactant, you can see the attractive forces at the surface disrupted, and this reduces the surface tension. So when the small alveolus deflates, the larger ones get bigger. And if you look on the right over at example B, it puts the formula for Laplace law into effect. And you can see the airflow from the smaller air sac to the larger one, leading to the collapse of the smaller one. So in the absence of surfactant, the attraction between the water molecules can cause an alveolar and air sac collapse. So in example C, with the surfactant, there is no crossover of airflow and there is no pressure gradient, and the air sac remains without collapsing. So in summary, when we look at this, in the absence of surfactant, the attraction between water molecules can cause an alveolar or an air sac collapse in the lungs. So we've got time for questions and some discussion. And what about babies that are stillborn? Do they produce the surfactant? Here are the different works that I cited for this presentation.